Well, I am honored to be introducing my friend Steven Blaylock. He serves as president for the Healthcare Foundation of North Mississippi and vice president for North Mississippi Health Services. Steven joined the North Mississippi Health Services in 2007, holds a bachelor's degree from the Southern Mississippi and a master's degree in healthcare administration from the University of Mississippi, and completed his postgraduate studies in management at the University of Wisconsin-Madison. He is a graduate of the Jim Ingram Leadership Institute, the Community Development Foundation and Leadership Mississippi, a program of the Mississippi Economic Council. Steven also serves on several community and state board of directors. The Rehab Center is included with one of those. He's a member of Kiwanis International and teaches 4th grade Sunday school at Brewer United Methodist Church. He and his wife, Stacy Blaylock, have 3 children. Steven, we're happy to have you today, brother. Take it away.
Thank you for asking me. Carol Upton invited me to do this probably 6 months ago, and I totally forgot until about 3 weeks ago. But luckily, if there is a silver lining of the pandemic, we don't have a lot of meetings going on in person. So I was able to be here today, thankful to be able to do this. The one thing that makes me sad is I have to look at a picture of Judd Wilson. I can't see his shiny face and his bow tie, but I appreciate the compliments on my appearance that you've already sent me this morning, Judd. Ride or die, right? So a little bit about me. I grew up in Tupelo, went to Tupelo High School, never truly appreciated the jewel that we have here in North Mississippi. And when I went to school at Southern Miss, I tried to go as far away as I could and where my parents didn't have to pay out-of-state tuition. I swore I'd never come home. And I turned out to be the classic college kid that really didn't know what they wanted to do. And so I was going to move even further away with a fraternity brother, a friend of mine, to Hawaii. And I came home to see my parents, and I met my wife. And she had 2 things I didn't, and that was a job and a home. And so when she reluctantly said yes to marry me, I had to move to Tupelo. And, 15 years of marriage, 3 kids later, that is one of the best decisions I ever made. Not just marrying her, but moving home to this area. We have wonderful schools. We have so many blessings here. I can tell you that the Tupelo spirit is strong. So again, proud to be here today and thankful for this opportunity. So I'm going to begin my presentation, and I hope that Jenny will bail me out if I start to go down. Okay, thumbs up if we're okay. Okay. The Healthcare Foundation exists to support the health system's mission of improving the lives of the health of the people of our region. We've been around since the early 80s, and I'll get into that in just a second. Our office is down on North Gloucester Street. I always tell people between Reg Magnet and the UPS store, 2 places people frequent often. My office building actually used to be a catfish restaurant, and then it was a dental office, and then it was Bo Gibbons' corporate office when he was CEO of Lucky Star. But it's been our office since 2008. In the 1970s, the Healthcare Foundation began as a trust of the medical center. And again, let me minimize this. We raise, distribute charitable dollars to support that almighty mission of the health system. And we serve all of the patients, employees in the communities where we have those 7 hospitals and 45 clinics. We receive about 10,000 separate gifts a year from those donors all over North Mississippi. Essentially what we do, we support as patient assistance. Patient assistance is when we have a patient that enters one of our clinics or hospitals and they have a need. That need may be a DME, a piece of equipment, a walker, a wheelchair. It may be a life-saving prescription medication that they need. Most of us on this call, I would imagine, are blessed with means or insurance to purchase medication for ourselves and our family. And I can tell you that a lot of the folks that we see in North Mississippi and West Alabama don't have that luxury. Education, those are folks that are getting out of college, getting out of high school, and they want to further their education. It may be a non-traditional student who wants to go back to school to better themselves, or maybe to achieve their dream in an area that they couldn't when they got out of school. And then also that's education for patients. Let's say that you're diagnosed with breast cancer. We provide materials and information for those patients. One that comes to mind is diabetes education. About 20 years ago, one of our endocrinologists here in Tupelo, really wanted to develop a program where upon diagnosis, a patient could meet one-on-one with an educator that just went beyond, measuring your insulin, counting your carbs, the things that diabetics have to do, every day. But it went into cooking. How can you cook? How can you cut out things that harm your body? And so we continue to support those efforts today. Employee assistance is a fund that is funded by the 7,200 employees that we have here under the systems umbrella. That is $500 a year in the form of a mortgage payment, a car payment, an insurance payment. We've even bought, clothing. And to qualify for employee assistance, a employee must, have an unplanned tragedy, a house fire, a tornado, the death of a spouse. The employee may have surgery, run out of leave time, but they're still in the hospital. So there's an application process where we can then go in and like I said, pay the employee's mortgage, car payment, something like things that they have to assume some normalcy in their life. And of course, special projects, we support many other nonprofits like Regional Rehab, the Free Clinic, things that make our community great. This is a video that we created when COVID landed, and I'll tell you more about it in just a second, but this video really is a fantastic example of why we exist and what we do every day.
Some of life's most difficult moments are faced within hospital walls. A baby born too early spends weeks in the NICU, and his parents have to drive an hour or more each way to visit their little one. A grandmother is diagnosed with cancer and has to make choices about where to spend her limited income, on her utility bills or on her cancer treatment. A young father has unexpected heart problems and needs help getting the equipment he needs for life-saving treatment so he can see his kids graduate from college. During hard times like these, the Healthcare Foundation of North Mississippi is able to offer hope.
My name is Jessica Fears, the nurse manager in ICU, and we partner with the foundation to help families through unexpected hard times.
We are here for those that need it the most.
The Patient Care Fund really provides our patients with the very best supportive care they can get.
We need to be able to come together and help each other out.
We're able to help with electric bills and transportation services, help with gas cards to make sure they have the fuel needed to be able to get to treatment.
Sometimes these families have problems and have to stay longer than expected. So we provide them with a place to stay, with clothing if needed, toiletries, a hot meal through Eddie's Fund.
It might be that mother of 3 that walks into the emergency room and is handed 3 prescriptions. No idea how she's going to pay for that.
Even sometimes we do have sad moments Most of the time it's happy, but there are times where a baby will pass away, and the foundation have helped us with burial costs for that family.
It could be any of us that get diagnosed with cancer at any time. So it could be you or I sitting in that chair that finds themselves needing help.
The Healthcare Foundation of North Mississippi is the philanthropic arm of North Mississippi Health Services, a regional health system that includes 7 hospitals, 45 clinics, home health and hospice services, as well as nursing homes and much more. We care for patients in a 24-county area in North Mississippi and Northwest Alabama. Help us continue to offer hope to our communities. What you give today can help someone you know tomorrow.
So with your donation, with the Patient Assistance Fund through the Healthcare Foundation, I'm able to pay for those prescriptions. They may be $20, they may be $200, but I can assure her and her family that they get the prescriptions that are needed.
Your gift to the Healthcare Foundation gives our patients hope.
Your gift provides a large amount of hope for our smallest patients.
It could be me in that seat. I want to do my best to make sure that patient's need is met.
The gift you give today may come back and help you tomorrow, may come back and help your loved one tomorrow.
Okay, so the help that they were describing in the video, essentially what we do is we have over 80 funds, restricted funds that range from breast care to community outreach to scholarships, endowments. And when someone makes a gift to that restricted fund, we park it there until a need arises, like these expenditures here. This is just on an annual basis. $36,000 to breast care. That is all free mammograms that we do all around the 24 counties that we serve. Cancer care is by and large the biggest one. You know, those cancer drugs are very expensive, that because we're connected to the health system, we're able to buy those at cost. And the hospital, the health system here has enormous buying power. So we get them very inexpensively, and we're able to be good stewards with those dollars given to us. Also, cancer care, we pay a lot of mortgages, utilities. We've bought tires for a patient. We had a gentleman walking from Moorville, Mississippi to get chemotherapy because we didn't realize he didn't have a dependable mode of transportation. And when asked how we could help, he just wanted a new pair of shoes. And so we got him 2 pair of Hoka tennis shoes to wear on his walk, because essentially he wanted to walk. He said that was his therapy, but he just needed some new tennis shoes. We're happy to provide those for him. Diabetes, insulin is pretty expensive. My favorite diabetes story is the mom who called me with a diabetic child. His insulin was $600 a vial, and he went through 2 vials a month. And she told me, I've sold everything I have. My church has helped me. My mom has helped me. You know, aside from winning the lottery, we don't know what we're going to do. And so to this day, we're still buying that little boy's insulin every month. Education, that's the $100,000 in scholarships we provide throughout our region. HIV is essentially food, groceries. We see a high number of indigent patients in that HIV category. And so we buy their groceries, you know, something that we probably don't ever think about, but is very important to their survival. NICU, you know, when mom and dad come in, my wife and I are very lucky. We had 3 healthy, typical children. But I can't imagine when it's at the time of birth, when your baby's shipped to upstairs to the NICU. And, you know, these mom and dads pretty much move in. You know, they want to be with their child around the clock. And so we feed them while they're here. You heard the NICU nurse manager talking about, you know, at the time of death, we're able to help out. And then also we have a fund that supplies breathing monitors to those parents. So when the baby goes home from the NICU, they can get a good night's sleep if the baby sleeps. We all know how that is. but the monitor the baby has on connects cellularly to our physicians at Women's Hospital. So if there are either any breathing problems, that physician calls the parents and the baby comes back to the hospital. Those are very expensive, but if the physician orders them, we're happy to provide that peace of mind to those parents. And then just one of our community hospitals, NMHC West Point, that $35,000 a year, that is a mix of diabetic medication, transportation to and from, an ER visit, a women's checkup, for a total of 2020 of $1.1 million. Probably the thing that we're known best for is Take a Swing at Cancer. And, it's a fantastic event that raises quite a bit of money, $220,000 in 2019 for our cancer program that I just spoke about. Dr. Sam Pace has been the long-term chairman of this event. Take a Swing essentially is 2 days on 2 golf courses. We have a tennis tournament, a gala, a live auction. Dr. Dick White serves as our auctioneer. And again, $220,000. It is the largest nonprofit, or I'll say non-professional or amateur event in the state of Mississippi. We began working on Take a Swing in January, and it takes all we got to pull it off. We have about 40 fantastic volunteers. Several of them are on this call today that make it happen. And we postponed the one in 2020, but we're coming in strong, hopefully, in May 2nd, 3rd of 2021. When COVID landed, I was actually on vacation with my family for spring break, and I got a call in a restaurant we were in the parking lot of a restaurant in Atlanta, and it kind of hit home to me that this was real. So between Atlanta and Birmingham, the community campaign was born. It essentially is an online fundraising tool that we created to support our front lines. In those days, when a COVID team member entered the floor, they couldn't leave for 12 hours. And so the community came in big, feeding those employees. Also, we provided discharge medication for COVID patients. We provided transportation for COVID patients when they left the hospital. And then also we provided transportation for families when they came in at the time of death. In addition to the money that was donated to us, we saw around $5,000 in gift cards given to us that we dispersed to the frontline teams, PPEs, masks, meals. Chick-fil-A through Amanda Engel showed up one day and fed everybody. Just incredible Tupelo spirit throughout this. I had a local business owner call me one day and ask me if our folks would like some socks. And I said, sure. Little did I know he was bringing 6,000 pair of socks for us to distribute. And we did just that. And then also 600 t-shirts. Here are some pictures of our frontline teams. Now, when I say frontline, we have about 100 people that are dedicated to the COVID floor, but also it's the ER, environmental services, the crew that keeps our system clean and sanitary. Also pathology. Where would we be in COVID without pathology? Security, ambulance services. Those ambulance folks have transported patients all over the country through this. And then, all the teams at our community hospitals. This is not just a Tupelo thing. It's in all of our hospitals. So we fed, we gave out hand sanitizer. Down in the middle on the bottom, you'll see some of those gift cards that were donated by local businesses to us. And then, we kind of saw for the lack of a better word, a lull in COVID. We kind of stabilized. The positive cases were still there, but they weren't through the roof as they are now. And then, the days we're in now, it's back up. It's higher than it's ever been. And so one day I got a call in my office from a RN who works on 5 West, our COVID floor. And, their experience is when they receive a COVID patient, You know, there's no visitors. It's not like when grandma goes in the hospital last year and you can come and go and visit grandma and bring her snacks. Those days are not here now. So those clinical personnel become those patients' family. You know, they're there during the good times, the bad times. When decisions are made, they stay into constant contact with family members. And there's a bond. You know, we're human. Human nature requires or makes you connect with people. And so they connect with those patients. And at the time of death, those clinical personnel wanted something they could extend to those family members. And so they developed the idea of a care basket. You know, the basket, it's got a Bible, a prayer cross, notes, you know, tissues, just something that they can give to try to show that, you know, they're thinking and praying about them. We began this 2 weeks ago, and we are sending new baskets to all of our 7 hospitals every day. We've asked the community to donate $50 a basket to assemble those, and it's up and running. Again, that Tupelo spirit is strong. A big part of any foundation, especially in a large health system, are its employees. You know, I'm asked all the time, you know, what's your largest donor give? Well, I can tell you my largest donor gives around $600,000 a year because they're the employees of the health system. So in September, even in COVID, we began the first ever system-wide employee giving campaign. And, you know, life morale is low. You know, we're stuck at home. We can't hang out with friends. We can't do supper clubs. You know, it's a stretch to play golf. We're just, you know, depressed, for the lack of a better word. So we wanted to do something upbeat with our employees, and at the same time, ask them to continue to support us. I can tell you that the executive team for our health system showed true servant leadership through this. Shane and his team, they went step for step with me all over this health system, showing our appreciation. We handed out around $5,000 in gift cards just to random employees because we're thinking about them and we wanted to give them a reason to smile that day. The battle that they are going through every day is undescribable. So if a gift card to Subway or a local eatery puts a smile on their face, that's the least we can do. Throughout the campaign, we saw 532 new donors who signed up. 353 increased their gift for a total of $150,000 in new money every year. And also, as I'm going through this, please interrupt me. I live with 3 kids. I'm interrupted all the time. So interrupt me and ask anything you have. What's the difference in HCF? You know, we're a charity, 100%, 501c3 through the federal government. Everything given to us is tax deductible. Also, you know, 100% of what you give follows donor intent. On your memo line on your check, if you say apply this to cancer, I do that by law, and we are audited twice to make sure that I follow those instructions. And then also the health system pays 100% of our operating cost, so that there are no management fees, there are no salaries that come out of money we raise, nothing. 100% of what we raise goes to its intended purpose. And then all your money stays here. It stays here to help and improve the communities in North Mississippi and then also West Alabama. This is the last page. I was instructed to keep it short and sweet, so it's only 13 slides. But if you want to reach out to us or me with questions, or you want to support anything that we do, there's our phone number, and then also our website. It's loaded with lots of good information and ways to support us. And then also Facebook, the best marketing tool around. We're the Healthcare Foundation of North Mississippi. We have a page, and we put graded pictures of employees and things that we do on a daily basis. So At this time, I'll take any questions if anyone has any.
Any questions for Steven? I'll ask, what has been the biggest challenge you guys have faced given the world we live in today versus the world we lived in last year at this time?
Well, I can speak from the foundation perspective. I'm probably not the best guy to answer clinical questions. You know, in my line of work, personal touch is a necessity. And raising money on Zoom is very awkward, but we've been successful. Really just the ability to sit around a table with someone, have lunch with someone, to do just what we're doing today has probably been our greatest barrier. But I can tell you that, as I've said a couple of times, that Tupelo spirit has prevailed, and we've been successful.
Any other questions? Okay, well, Steven, thank you very much. Appreciate it. Really,
Thank you, sir.
To have you join us today. Thanks, sir.